Hi, today is December 5th, 2012. I'm about to head into into surgery, a microdiscectomy for my the disc between a disc herniation between L4 L5, and I wanted to record this and post it for anybody that is considering this surgery, and just kind of go through my decision-making process. I've looked at a lot of different posts online, and they were very helpful to me, and I wanted to pass that along as well. I haven't had, well, first of all, I'm 44 years old. I've had some changes in my spine based on some x-rays that were taken a couple of years ago, and just typical aging process, and you know, some arthritis here and there. I'm pretty active, work out 5 days a week, play golf frequently. I did up until my injury about a month ago, and you know, would experience arthritic pain here and there just from the normal aging process. Would do a lot of yoga, and that would, in the morning, and do some back exercises, get the blood moving, and all that would go away, and I'd be just fine. About a month ago, I was playing golf and didn't really warm up properly. I'm pretty adamant about doing that, but in this case, I was just trying to get on the course and see how it worked if I didn't warm up beforehand. And sure enough, on the third hole, I felt some twinges before playing golf and didn't warm up properly. And by the third hole, I took a swing with the driver and I felt the instant pain, different than any kind of pain I'd felt before. I did take a bunch of anti-inflammatories, some ibuprofen, played for the rest of the day, and was relatively pain-free once the medicine kicked in. But then about 4 days later, I started to feel the pressure in my glute on the left side, and probably worsened it by doing a bunch of downward dogs in the morning, some yoga exercises and stretching. So I probably inflamed it worse, not realizing I was doing so. And within about 4 days, I guess the following Saturday, it was about 7 days total, I was literally on my hands and knees. And by 2 days later, Sunday night, I was in such excruciating pain, I didn't think I was going to make it through the night. Next day, I went to the orthopedic and got a shot of cortisone, reduced the inflammation, took some oral steroids, and within 24 hours, I was able to walk again, whereas before I couldn't walk at all. Had an MRI done, and the results were such that they instantly said, look, you need to talk to a spine doctor, you're probably going to need surgery. The herniation was, the extrusion was significant enough that it was traveling up the L4 vertebrae about halfway and really putting pressure on the nerve. And the concern was once the steroids wore off, I'd be back where I was. My decision for moving forward with the surgery so quickly, it's really been a month since that initial injury on the golf course, was that the main, I guess, issue is I've got some numbness, a fair amount of numbness running from below my knee to my ankle. And that hasn't changed in over a month. I had a second opinion from a doctor that said, well, you might want to do an epidural. However, from my research, the pain block and the steroids aren't going to reduce the jelly material that's exited the disc from the rupture, which again is fairly significant, pressing against the spine. So the doctor who works on pro athletes that's going to do the surgery in a few hours, said, look, this is a textbook case. We'll remove the jelly, the pressure on the spine, and hopefully you won't have any long-term nerve damage, which is the main concern if I just let it be. I'm not in significant pain. I do probably have a low-grade pain in my shin area. From my research, any pain below the knee is where you should really look at surgery, any sciatic pain. And for anybody making this decision, I think that doing a lot of research, it's a personal decision. I want to remain very active, and because I can already tell from the pinched nerve, my left leg is starting to atrophy. It buckles every now and then as I'm walking. I certainly couldn't do anything active on it, and and it's much weaker than the right leg. So that's kind of what factored into my decision to go forward. So I've appreciated the other blogs that I've seen on that have been posted on YouTube, and I'll continue to track my progress. And what I've noticed is a lot of the blogs kind of fall off at 4 to 5 weeks, which I think is a good sign. And my expectations for this process is that for 2 weeks, I really won't be doing anything too active, won't be driving. We'll certainly be walking around as prescribed. I think at 4 weeks, I expect to be able to, be starting physical therapy. And from what I understand, 6 months out, most people that get the surgery done forget that they ever had the incident to begin with. So hopefully I'll have those results, and I'll be back to report in.